So, I may not have started. Let me try that again. So I'm here to talk to you about the behavioral health implications for those who serve, our veterans, and their families. And to talk to you about how the Community Blueprint offers a really wonderful opportunity for communities to address some of the mental health issues that come home from war. So there are certain things that we know. We know that everyone who experiences combat is affected by that experience. That doesn't mean that everyone who comes home is damaged or comes home with post-traumatic stress or traumatic brain injury. Sometimes they come home and they join wonderful organizations like Service Nation, the U.S. Chamber of Commerce, the Mission Continues, Student Veterans of America, Blue Star Families, and on, Team Rubicon, and on and on. But no matter what, they're affected, they're changed, and that means that when they come home, there's a transition, and that we in the communities need to be ready to step up to respond to those changes to make sure that we assist with the transition. We also know that families are affected by deployment, by reintegration, by combat stress if that comes home. And again, military families, they're very strong and they're very resilient, but we in the community need to do more to make sure that they continue to be that way. That wasn't me. Another thing that we know is that although most do not come home with significant mental health concerns, a significant portion, a large portion, a concerning portion do come home with significant mental health concerns. We know now that about 35% of those who see combat duty will come home and at some point will have significant mental health issues that if they're not addressed will become disabling, destructive to themselves, to their families. We also know that these mental health issues, they don't behave the way that a physical injury behaves. So if you get a broken leg tomorrow, it hurts like hell. It hurts, you go to the doc, you get it hopefully repaired, the healing begins, you go to physical therapy, you do whatever you need to do, and after a while, especially if you're young, it's hard to know that you ever had a broken leg. That's not the way that psychological injuries work. Psychological injuries don't look the same for different people who might have experienced the same trauma. They don't look the same for the same individual across different periods of time. One person may come home and they do fine for several months, and then something may trigger development of symptoms. Post-traumatic stress can show up months, years down the road. And we know that if we don't address those issues, then many, many will suffer. We also know that families are significantly affected if we don't address the mental health issues of those who serve when they come home. Their families will also experience post-traumatic stress, depression, anxiety. If the issues of the service member or veteran are not addressed, families will suffer. The good news is there's a ton that we know what to do about. We know how to help those who serve with these psychological issues if they are suffering. One size doesn't fit all. We need to make sure that options are available, that access to care is available. We need to make sure that those who are in need are aware that what's happening to them totally makes sense. They're not crazy. They just went through traumatic events that would affect all of us in different ways. So there are a couple of challenges as we set about to address the mental health issues that may come home with those who serve or that may be affecting their families. The first is we need to educate and raise awareness. It's a simple statement, but it's very hard to do because we're a big country and lots of people touch veterans, service members, military families. The Community Blueprint, this whole concept of bringing folks together, it does a tremendous amount to begin that process because people start talking. People like me are in meetings with people who are working on employment or who are working on volunteerism, and we share information. And we get education out to the people who will later touch those who serve as they come home. The other issue that we need to address is to make sure that those who might be suffering with the behavioral health issues that we see as an understandable consequence of war, that we reach them, that we find them, that we communicate to them. And again, the community blueprint, by engaging our service members, our veterans, our military families, we bring them into the community so that they start hearing about the different services that are available. They start hearing about what opportunities there are, what these issues are, how to understand them, how to make sense. We've had so many service members say to us in Give an Hour that they got help, not for themselves, but because of their families, because they learned, they heard somewhere that if they didn't address their drinking, it could affect their wife or their kids. So as you listen to these talks, know that there are so many different things that you and your communities can do. On the behavioral health side, we know so much more now. So thank you for your interest in the community blueprint and in what we can do to help those who serve.